All right, so we are officially live here. I'm going to pop over to our Facebook page and make sure that we are good to go, and then we'll wait a few seconds just to let people tune in with us. Okay. All right, welcome. I see that we've got someone on already, so we'll give it just a few more seconds and then we can go ahead and get in. All right, so I think we are 1 minute in. Let's just check here. Oh, hold on. Just confirming with others that they can see us. Can you, if you can see us, can someone drop us a comment just to make sure that we're good? Oh, awesome. Hi, Christy. I see a wave.
All right.
Fabulous. All right, so we're going to go ahead and jump into it. I know sometimes with technology, it can get a little funky, but we're going to go ahead and jump right in. So hi, and thank you for joining us today for our Facebook Live discussing heart health. February is American Heart Health Month. So we are joined here by Dr. Hassan to answer some heart health questions. My name is Chelsea. I am the social media manager here at Network Health Wisconsin. We're going to dive into questions in just a minute. We're going to have a great discussion here. Hopefully you can learn some new things about heart health, but just wanted to chat on some housekeeping tips quick. So if you have any questions at all during the live, go ahead, drop them in the chat. We're going to do our best to address all of them towards the end. So feel free to, as they come up, just drop them in there and we'll review those. If you think of anything after the live or you're maybe not comfortable dropping it in the comment section, feel free to give us a message. You'll be talking directly to me and I can follow up with you after that. During the live, we'll also make sure to drop any relevant links out to additional information, and any links that are discussed during this chat today will be also dropped in the comment section here. So you have something to come back to if you need to further research that. So without further ado, we're going to get into it with Dr. Hassan, who is our Network Health's Chief Medical Officer. So welcome. Thank you for joining us today. And I'm going to jump into our first question. So can you tell us, what does a healthy heart look like?
Well, Chelsea, thanks for having me this morning. When I think about a healthy heart, I like to think about the heart as a central pump that we've got in our body to get blood that has oxygen to tissues that need it, as well as take blood that has been depleted of oxygen back to the lungs to get oxygenated again. And so, from a pump standpoint, you have a functioning pump that has has structural concerns as well as plumbing concerns. We're making sure that you're getting enough blood flow to that heart. So I like to think of it in two ways. A healthy heart has adequate blood flow to feed the muscle, and then the muscle itself needs to have a pump that has adequate health in terms of valves as well as muscle strength and things of that nature. Those two things kind of, to me, if those are both going well, that's a healthy heart.
Awesome. Can you touch on a little bit on things like blood pressure and heart rate? What do those things mean and how can they change during aging?
Sure, that's a great question. So, a lot of folks know that we as doctors will monitor people's blood pressure as well as check their pulse and do these things as part of what we call vital signs. And the reason vital signs are so vital is because we know that an elevated blood pressure and elevated heart rate for a prolonged period of time can put a strain on the heart. And when I was talking about the pump remains healthy if we know that the blood pressure stays within a range that it doesn't have to work too hard. So most folks will quote a blood pressure less than 140 over 90 as being the range that you want to be in, preferably 120 over 80 or less as being kind of a healthier range. If we're above that, then what that's doing for the heart is it's asking the heart on a regular basis to work harder than it needs to, and that's going to cause the pump to likely wear out sooner than it should. It may potentially enlarge the muscle of the heart and outstrip its blood supply. So you have some ongoing damage that can occur with a blood pressure that remains elevated for too long. By the same token, if you have a pulse that's too high for too long, you have two factors that come in. One, a heart rate that's too high is going to cause for inefficient pumping of blood because the pump doesn't work as well if the pulse is above 100 for too long. And the second issue is that if you run the heart that high for too long, you can think of it as overheating the heart, and that the heart's going to again work too hard, and that muscle is going to have some premature decay that can occur.
Gotcha. Yes, that's good to know. Thank you for touching on that. So I think that's a perfect segue into talking about what exactly is heart disease. I know that that's a term that I'm sure a lot of us have kind of heard, but it's maybe don't exactly know like what that means. So can you kind of dive in and explain, what is heart disease? What are some of the symptoms, long-term effects? What are risk factors of heart disease? And just kind of speak a little bit more and kind of tell us about that.
That's a great question. So, for the most part, most folks will know heart disease as being disease of the blood flow that feeds the muscle of the heart. And so I want to talk about that first. So, certainly, this is where, if you think of my plumbing example, do we have enough blood flow coming into the muscle of the heart? And things like cholesterol buildup in the arteries of the heart is what tends to concern most doctors. And that buildup of cholesterol can lead to cholesterol plaques, and those plaques can cause narrowing of the arteries, which can then compromise blood flow to the muscle, which leads to a heart attack. And so, certainly, keeping the blood vessels that feed the heart as open and clear of blockage as we can is something we as doctors want to make sure we do as far as ensuring that heart disease doesn't have a premature manifestation. So, from a plumbing standpoint, keeping those arteries that feed the heart unclogged is the central part of helping to reduce the risk for heart disease that's more vascular in nature in the blood vessels that feed the heart. Now, if you think about the pump side of things, you can also have potentially heart disease where the valves of the heart could potentially decay and cause extra strain because these valves are the doors that let blood in and out of the heart. And if those doors get either rickety or calcified, where they don't open and close as well as they should, the heart muscle behind it's going to have to work harder than it should. These are things that you may have heard of, like aortic stenosis, or I have a murmur that is caused because the door doesn't close all the way. Not all murmurs are bad, but if you have a more severe murmur, that can potentially cause the heart to have to do extra work that it doesn't need to from a structural side. And so, in that standpoint, you can think of heart disease as potentially having valvular heart disease be underneath that as well. But for the most part, most lay people know heart disease in general as being blood flow to the muscles of the heart as being the primary manifestation of that. But I always like to point out that there are structural issues that can come up as well, where you want to be careful about managing that. That becomes more of an issue as we age as well, because obviously with each decade we have aging of those doors opening and closing for 50, 60, 70 years. You're going to have some potential difficulty with calcification. In addition, given that we do live in diverse communities, if you have folks that have childhood experiences that are spent overseas in other countries, they may have actually been exposed to childhood illnesses where they didn't get antibiotics and they get what we call rheumatic fever. And that can cause valvular disease as a child that can then cause some early calcification of the heart valves later in life. And so that is something that we can find as well. We don't see it as much in America anymore because we've been much better about treating childhood infections early on with antibiotics. But again, not every society has access to the medical care like we do here. And so folks that may have emigrated from other countries here may need to watch that, which is why the doctor listens to your heart during your physical exam, just to ensure there's no murmurs that are heard.
Gotcha. Yeah, that makes total sense, and it's good to know. It's other people have different experiences. That's excellent to know, and I think those analogies really help. I'm sure any homeowners listening in here know the creaky door can be a pain.
Yes.
And I know you kind of just touched on it, but are there any other risk factors to heart disease that you can touch on? I know age, different communities. Is there anything else that risk factors that people should be aware of that might make them more susceptible to heart disease?
So Chelsea, you brought up a couple of very good ones. I think first and foremost, we look at age. Obviously, aging is going to leave persons at risk for heart disease just with the development of time. Over time, you're going to have potential plaque buildup that can occur in the blood vessels of the heart. But looking at it the other way, if you have a family history of having early heart disease, and by early, most doctors would say before the age of 50, then there may be the potential for genetic conditions that allow cholesterol buildup to occur earlier in your particular family, in those family hearts, because of genetics. And that's where there are opportunities for early testing that we can do to see if a premature history of heart disease might warrant further testing at an earlier age so you can best understand what your risk is. And this is where patients will ask about, hey, doctor, should I have a calcium scoring done? Where you can get a CAT scan of your heart to see if there's any calcium buildup at an early age. Generally speaking, I advise patients that that's something to consider. If you know that you have a early history of family heart disease before the age of 50, and you're probably in your 30s or 40s just starting a family, want to get an idea of where's my risk at. Um, I tend not to advise that after the age of 50 because at that point, a 50-year-old heart's going to have some degree of calcium buildup just because of being 50 years old. And so really you want to try and do this for more for folks that have heart disease at an earlier age to help screen them. So we've talked about age, both over 50 as well as some premature,
Mhm.
family history, and then some genetics that can be there, and obviously our diet. And so being able to have diet that is more leaning towards, I like to say, two-legged animals versus four-legged animals. So poultry or seafood over red meat. Certainly a plant-based diet is also a good idea. So these are different opportunities that we have to intervene from a diet standpoint. And certainly we also thankfully have addressed a larger risk factor that's been in our society, and that's tobacco. And so cigarette smoking still continues to be a major contributor to acceleration of heart disease, in particular for folks that have diabetes. And so you want to be, if you're a diabetic patient and you are still having difficulty with being able to get off of cigarettes, it's really important to try and work with your doctor to see about measures that we have to help educate, as well as potentially using medications to help reduce the craving for cigarettes that are there. And at Network Health, we certainly have our nurses that can help reach out to members about methods that we can do to keep their hearts healthy, as well as potentially offer options for smoking cessation programs that are there as well. So if we could go through, certainly we have diet, we've got habits, smoking in particular, we've got family history, and we've got understanding, the influence of age on the whole process that's there as well. There's also some good data that suggests that folks that are more physically active on a regular basis tend to be stricken with less heart disease. And that's likely because folks that are physically active are going to generate some natural extra blood vessels in the heart. I like to think of them as sort of natural angioplasties, that you have, you have what we call them coronary corollaries, that you have extra blood vessels that kind of make themselves up because you're training your heart to be more tolerant of cardiovascular endurance. And so I like to say minimum 150 minutes of exercise per week is a good goal to get to. And that's kind of nice. Just a half-hour walk after dinner is always a good habit to try and get into as much as you can. Now, living here in Wisconsin, that may involve either finding a mall in the winter or joining a health club and being able
Mhm.
to find opportunities where maybe the health club investment is actually an investment in your health. So that way you're forced to be able to have more of a regular basis where you're making an appointment for yourself to make sure you take care of your health.
Yeah, absolutely. It's so good to know that there are these risk factors, but that there are ways to get help to overcome some of those risk factors and have a really healthy heart. So that's fantastic to know. So pivoting into our next question, can you talk to us a little bit about what exactly a heart attack is? What some of the signs are. What does it mean to your heart when you actually have a heart attack? And then touch on what are the things to do if you think that you are in fact having a heart attack.
Again, a great question. What we want to do is we want to understand what are the things that I should be watching for where I can be concerned that my heart is not happy with me. And the underlying physiology is blood flow to the muscle has been interrupted. And that muscle then is not getting enough oxygen. And so that when your muscle doesn't get enough oxygen, what's going to happen? It's going to start to decay and build up acid, and eventually muscle cells will start to die. At a physiologic level, that's what a heart attack is. And so we as doctors will then be able to measure some blood tests that can show that, as well as EKG changes that show that here is a heart muscle that's under strain. But we can only do that if persons present for medical attention. So we want to look for what are the symptoms. Well, the first and foremost, everyone knows chest pain. In particular, chest pain that goes from your chest maybe into your left arm. That's the classic sort of heart attack symptom that we find.
Hmm.
Now, other patients can have chest pain that goes maybe up into their neck, and pain that in particular lasts for more than 5 minutes, likely has some sweating, maybe a little bit of shortness of breath associated with it as well.
Hmm.
Sometimes folks can have actually chest pain and a little bit of nausea because you're having difficulty with the back of the heart losing blood flow. And so, really paying attention to ensuring that you're having careful attention to chest pain, I think, is the thing that I like to advise to folks as being the
Hmm.
most important. In addition, I talked about exercise. I think it's important if someone has a regular exercise regimen that they do, if they notice a change in that, where, for example, I could used to mow the lawn last summer, I could do the front of the house, no problem, and then I have to stop to rest. Now I get halfway through the front lawn and I have to sit down to rest. Well, that's a change in exercise tolerance. Maybe that's a sign that your heart is starting to build up a little bit of narrowing of the blood vessels that we should probably see the doctor about to catch this before it becomes an actual heart attack per se. And
Hmm.
so if you start to notice a change in what you're able to do, whether it's regular exercise that you've been doing, taking the laundry up and down a staircase, for example, walking at the mall where you cannot get around the whole mall, but just changes in that nature may be an opportunity to talk with the doctor to say, hey, I noticed that I'm having some difficulty. I actually had a patient of mine that we ended up doing a cardiac stress test on. Um, his main symptom was, I'm having trouble walking at O'Hare when I go to Florida. And so we chased it. He said, I used to have trouble walking from security to the gates. And so when we were able to chase that down, I was like, oh, wow, we actually have some heart disease here. And his first symptom, what he noticed was, hey, when I went to Florida, I noticed that I had some trouble walking at the airport. And so really being able to ask these questions just to ensure that we catch things early would be the best way to catch it before it becomes a problem. But
Hmm.
the red flag, red lights on fire that we want to watch for is having chest pain in particular that goes into your left arm or up into your throat or potentially behind your heart into your stomach to cause some nausea and vomiting as well. Should any of those things happen, you want to likely pop an aspirin at home and then get yourself to an emergency room. Ideally, have someone else drive because
Yes.
there's a chance that you may potentially,
Yes.
faint because things are getting worse. If the pain is not going away, having any difficulty breathing, then call 911 right then and there because
Hmm.
now most EMS crews, they can do the EKG right in the field, and if they need to start intervening right away, they can intervene even while they're at your home, bringing you to the hospital for medical attention.
Yeah.
The old adage is time is muscle. So the quicker we
Hmm.
can get folks that are having a heart attack into a cardiac intervention center where we can open up that artery with an angioplasty, for example, we're going to
Hmm.
save that muscle, especially that first hour or so. So really being able to pay attention that, hey, this is something that's different. I should likely do uh, something about this just to ensure that I'm getting things evaluated quickly, and getting
Hmm.
that initial EKG right away is the first thing we want to do.
Yeah, absolutely. Yeah, so important to listen to your body and notice those little signs, right? Like even if it's something, yeah, as simple as walking through the airport, it's different, then get it checked out. That's important. And I'll admit, I think I learned something new there. I always kind of knew what a heart attack is, but the specifics of what actually happens, I didn't know. So that was excellent to learn myself as well. And so you mentioned in there aspirin. Why aspirin, and how does that kind of help your heart in that situation? And I think, I've heard in the past, taking aspirin is helpful for heart health. Can you touch on that a little bit more and just kind of talk about aspirin and potentially other, heart medications that we should know about?
Sure. So aspirin is a blood thinner. So the way that aspirin works, it helps to reduce the potential for our platelets, which help us to clot blood, from being as active as they are. So it helps platelets become, I like to say, more slippery. And so if you are having a heart attack, the logic is that you likely have some occlusion of a blood vessel caused by platelets aggregating together with cholesterol. And we're trying to break that up a bit just to allow further progression of that clot to not occur. So taking the aspirin allows folks to have less in the way of aggregation of platelets to cause that. What's important to understand is that taking that aspirin within that first hour in particular
Mm-hmm.
helps people live longer. They survive heart attacks. So it's really important to get that aspirin on board right away. Now, you asked a second question that's also very important.
Mm-hmm.
A lot of folks have been advised to take aspirin every day just from a heart health standpoint. Um, there is some new data that's out there about this, where the benefit of taking aspirin every day for a heart health standpoint has to be weighed against the risk of thinning your blood and leaving you at potential risk for bleeding in your stomach. And
Mm,
so now, in particular, I would advise for women that are over age 65, there's pretty good data that suggests that it may not be as beneficial to do that for someone who's never had heart disease before. If you're just taking it because I heard it's healthy to do and you're otherwise healthy, you likely don't need to take an aspirin every day after the age of 65 if you're female. Um, if, however, you've had heart disease, then there's clear evidence that taking aspirin every day helps you live longer.
mhm,
So for folks that are just taking it prophylactically that don't have any other medical conditions, it's probably a good idea to have a discussion with your doctor. Does aspirin make sense for me? Because there's a benefit and a risk that's there. The benefit is keeping your blood thin. The risk is thin blood could cause stomach bleeding. And
mhm,
so we have to balance those two things out. Certainly, there's other medicines that we use for treatment of heart disease. In particular, and I don't know if you're going here or not, Chelsea, but cholesterol drugs, for example.
yeah.
And so a lot of folks have heard of drugs that we call, quote, statins, atorvastatin, simvastatin, lovastatin. These are all different statin drugs that are a class of medicines that filter through your liver and help the body to reduce their cholesterol by reducing the metabolism of cholesterol in the liver. These drugs, again, have data that have shown benefit to help people live longer if they have high cholesterol, especially in the setting of a heart attack.
Mhm,
And so taking these drugs to help reduce the risk for heart disease has been advised by doctors because we have this data that suggests that it is beneficial to stop either that first heart attack or to prevent a repeat heart attack for someone who's already had a heart attack. That is something that we do based on how your cholesterol numbers are looking. So having a discussion with your doctor about how your cholesterol looks is important. Now, given that we've been doing this for probably the last 20 years or so, there has been a lot more learning about what statin drugs do for folks. And so certainly tracking liver tests is important in this scenario. Some folks have had side effects where they have difficulty with blood test abnormalities. A lot of folks talk about muscle aches and muscle aches that can occur with statin drugs. And Network Health actually has a great handout about statins, what you should discuss with your doctor. And we can
mhm,
certainly share that with our members about being knowledgeable about the benefits of these drugs and how to help handle potential side effects that can occur as well. For example, folks that will come to me and say, look, I'm having some muscle aches on my statin drug, I'll ask them, have you tried coenzyme Q10? Because I've had really good luck with patients that take a statin drug plus CoQ10, feeling great and having terrific cholesterol numbers, and they do really well.
mhm. Yeah, fantastic. Yeah, so definitely important to discuss with your doctor. And we do have materials that we can share in the link in here as well. So that's excellent. Um, so thank you. I feel like we've talked about kind of a lot of the scarier heart health topics, and I know we touched on it a little bit in the beginning, but can we talk about some good ways to take care of your heart? So I know you mentioned some food. There's additional. I know we kind of touched on the exercise piece. But did you have any other tips for us before we dive into questions and say goodbye? But any sort of tips on how to keep your heart healthy and happy?
Well, that's terrific. So one thing we haven't really touched on, I said just once, but that's diabetes. But
Mm-hmm.
kind of knowing where is your fasting sugar, where's your fasting cholesterol, and how's your blood pressure doing every year around your birthday is probably not a bad thing. And so I like to always tell patients, hey, the month of your birthday, try to have a physical and try to make sure you get your cholesterol checked, your sugar checked, and you know where your blood pressure is at. Now, thankfully, most of the employers that we work with through Network Health will do a health risk assessment. So a lot of employees will get that done, and a lot of their spouses will do the same. So you're able to get that done actually through your employer, usually for free, which is great because then you can kind of get a sense for, hey, where's my cholesterol, where's my sugar, where's my blood pressure, and making sure those numbers are all in order. And for sugar, really your goal should be less than 100. And then making sure that your cholesterol goal again overall is less than 200, but having a nuanced discussion with your doctor about what all the numbers mean is probably a good idea. So
Mm-hmm.
if we have that, and we're kind of going after ensuring that we have less cholesterol in our diet, less sugar in our diet, well, that's going to influence what you're going to have. And so I like to always tell patients what one of my patients told me years ago. Doc, I always shop in the outside of the grocery store. I try to avoid the inside. And what
Yeah.
that means is that you're going to have, fresh produce, fresh vegetables, probably fresh meats, usually hopefully seafood or chicken,
Mm-hmm.
and then kind of avoiding any of the packaged processed stuff that's in the middle.
Yeah.
And so really paying attention to that, I think, is probably a smart thing to do. I like to really advise, listen, to try to really push for more fruits and vegetables in your diet on a regular basis. Be intentional about it. Choose that
Mm-hmm.
as a snack if you can. Try to really have 3 servings of seafood a week if you can. I tell folks that if you're having 3 servings of seafood a week, in particular bigger fish like tuna or salmon, you don't need fish oil capsules. You don't need that's something you don't need because you're having that enough in your diet. I always like to push diet as a source for good habits. Chicken and turkey certainly are always good options as well. Like my analogy I said before, 2 legs versus 4 legs, always a better idea.
Yes.
And then certainly red meat is something that we want to have more as a date night type of food or a regular, maybe less than once a week if we
Hmm.
can. And so really limiting the amount of red meat that we have. I also actually have to start to push for patients, think about meatless Mondays. Can you go
Yeah.
vegetarian one day a week? Just
Hmm.
to really kind of force your body to have less in the way of ongoing meat. Now, it's difficult in a country like ours that we have resources, we have access to meats. That it's a little, frankly, it tastes good, right? So we want to probably have that, but the moderation is really the key that exists
Hmm.
with that. Avoiding concentrated sugars in our diet is likely helpful to keep our sugars normal. Looking for labels for high fructose corn syrup is important. If you like to have soda or pop, depending on where in Wisconsin you're from, but having carbonated beverages, just be real careful about having that in moderation as well, because that's a lot of high fructose corn syrup that you don't necessarily have to have
Hmm.
right away every day. If you can, avoid that for something different, in particular, trying to shift to 8 glasses of water. If you have your big old water jug with you,
Yeah, there you go.
we can get you a network health one at some point too if you
Yep.
want.
Got my
Uh,
giant water bottle too.
that's important to have that just to kind of keep your stomach full of water as well, so that you have less need for caloric intake as well. That's from a diet standpoint. Then shifting to physical activity, I talked about, the goal should be 150 minutes of physical activity. That's the bare minimum.
Hmm.
I like to tell folks as well, if you really want to, kind of be aggressive about your health, with the doctor's advice, your goal should be 4 hours of cardio per week and 2 hours of weight training per week. That's going to keep you healthy in general from an overall standpoint. You want to be strong enough where you have some muscle training that's occurring just to kind of keep you physically active and sturdy. So that way, as you age, you've got the ability to kind of age gracefully
Hmm.
and have a good heart tolerance for exercise.
Yeah, absolutely. Fantastic. Thank you so much for those tips. Um, yeah, thank you. So
There's one question in the chat that I think is very relevant for us to watch for, and
yeah.
that is there potential for differences in how we approach chest pain for both men and women?
Hmm.
And that's very important because the reality is, yes, women can oftentimes not have the classical left-sided chest pain or chest pain going into their left arm. Having a change in exercise tolerance, having difficulty breathing, having a feeling of minor chest pain but with some sweats, really something that we want to watch for women. And being in tune with something just doesn't kind of feel right. Using the women's intuition, if you will,
Yes.
that it's important to really pay attention to that.
Hmm.
I would come back to, if one is able to really keep regular exercise as a part of what you do, when you see a change, you'll know this is something I should probably be chasing.
Hmm. Yes, absolutely. So good to know. Thank you. That was the question I was about to jump to. So it looks like that's the only question I see here. Let me pop over and just double check here. Um, Fabulous. Well, I do not see questions, but again, as I mentioned at the beginning, if there are any additional questions, follow up, you will be talking directly to me if you message us on social media, and I can connect with Dr. Hassan for further questions. But thank you so much for joining us. If you are a Network Health member and have questions about some of the programs for assistance that we mentioned on here, you can call the number on the back of your member ID card. If you are not a member with us, we'd love to have you. And if you are just looking for more health tips, you can check out our blog at networkhealth.com/blog. We have a ton of different health topics. We have a great number of topics on heart health. Some of those links are shared right here in the chat as well. So I will go ahead and say thank you so much for joining us. Dr. Hassan, do you have anything to leave us with before we end the broadcast here?
Chelsea, thanks so much for having me on today. We're hoping to do this on a more frequent basis about
Yeah,
different medical topics, which is something I'm looking forward to as well. But the key thing is eat smart, eat healthy, and stay active.
yeah,
If we can do that all for each of us, we're going to really have a healthier society.
absolutely. Yes, healthier hearts for everyone.
Yes, that's our goal.
Wonderful. Well, thank you so much, everyone, for tuning in, and we will see you on Facebook Live next time. All right, bye.
Bye bye.